One and all. On the occasion of the International Women's Day, from the PCO Society of India. Friends, my name is Ruby Sam, and I'm the co-chair of the Public Awareness Subject Interest Group of the PCO Society. I'm the managing committee member. I'm very happy to be a part of this session because today we have a very, very important session about the details of PCOS. PCOS is very familiar, right? What is PCOS? PCOS is an acronym for polycystic ovary. And it's a very common term because it's becoming very common and rampantly the numbers day by day. So all the women of the reproductive age group are very curious to know what is PCOS. Am I having PCOS? Is my friend having PCOS? Or is my daughter having PCOS? Answer all these queries today. I'm very happy to introduce a very educative public awareness program today on this platform, which is a program. So today I present to you the episode 1 of the season 1. We talk about the basics of what you understand by the terminology PCOS and major issue, which is usually fertility, which is very, very common question in the girls. This special program is called Vijeta. Vijeta, as you understand, winner. So let's all come together to win over this PCOS so that we can all live a normal life and not a different life from a girl who is non-PCOS. And we will listen from the experts on PCOS, a gynecologist, an endocrinologist, and other very well experts in these fields. Today, the first episode, basics. Later on, in the future sessions, we will talk about the treatment modality, about the diet, about exercise, and how to deal with PCOS if you want to conceive. Aspects related to fertility, in short. So before we begin to session, I would request all of you to also visit our website, www.society.in. The link will be shared to you a little later. Before we begin today's session, understand how much do you really know about PCOS? We have a very interesting poll coming in soon. So friends, stay hooked. Here are some questions which will tell you how about PCOS. May I request the poll questions to be displayed on the screen, please? So you will get 10 seconds to answer these questions. The first question is, do you think this is associated with only obesity? I can see some answers coming in. I request everybody to answer. A lot of people have answered that no, it is not related with obesity. We have the answers coming up soon. We will have the second question. The question is, the diagnosis of PCOS is made only by sonography. Answer yes or no. So you have to answer whether only sonography is required or other investigation and blood test. A lot of you have said yes. We can go to the next question now. Question number 4 is darkening of underarm, groin, and the nape of the neck a clinical feature of PCOS? I repeat the question. Is darkening of underarms and neck of the nape a clinical feature of PCOS? Yes, most of the answered yes. It is one of the signs of PCOS. We can have the next question, please. Question number 5. Can women have PCOS in their younger days, which gradually disappears as they grow older? So the question is, can have PCOS in the younger days, which disappears as they grow older? Again, the majority have said yes, it as they grow older. Next question, please. The first line of treatment to women is lifestyle management. Lifestyle management includes diet, exercise, good sleep, and stress management. 100% of people have answered yes, it is the first line of treatment, which we will, of course, learn in the future episodes of this season. Question number 7, please. Is low carbohydrate and a high protein diet ideal for PCOS? I repeat, is a low carbohydrate and a high by a qualified nutritionist in the upcoming. Next question, please. Now we have last 2 questions coming up. Can a woman with PCOS get pregnant? I repeat, can a woman with PCOS get pregnant? Again, a majority of the participants have said yes, any PCOS woman can become pregnant. Question, please. Does lose weight help in getting pregnant if you have PCOS? Does losing weight help in getting pregnant if you have PCOS? Once again, majority of them have answered yes, losing weight is helpful. Now we come up to the last question of the poll. Is a woman with PCOS at a higher risk of getting diabetes and high blood pressure? Is a woman with PCOS at a higher risk of diabetes and blood pressure? Now here the answers are varying seems to be an interesting question. So all the parties, about 14% of them have said no, it doesn't. And out of 6% have said yes, these women are at a higher risk of diabetes and blood pressure. So a lot of confusion in wonderful. So here we had all the questions just to understand what questions more frequently asked and how we can help you answer all these questions and break all the myths about PCOS. Now for that, it's my honor to have the President of India to give you a background of what PCOS and take you through the entire season and all of this season. It's my honor and I'm very, very privileged to have amongst none other than Dr. Duru Shah. She's a very, very eminent gynecologist. Ma'am is the founder president of the PCOS Society of India. As I said, she's eminent practicing gynecologist, director, Gynaec World, the Center for Women's Health and Fertility. Ma'am is also attached to hospitals like Breach Candy and Just Lok in Mumbai. She's several organizations on reproduction. She's a great author. She's been president of several associations. And there are n number of accolades and awards that ma'am has been received. And one has been the iconic Gynecologist and Fertility Expert Award given to her by Maharashtra last year at the Raj Bhavan. It's a proud privilege to have ma'am with us. Ma'am, I welcome you to today's session and I request you to present the presentation and give some information about and begin the session today. I welcome you, ma'am.
Thank you so much, Ruby, for introducing me, and I'm so thankful to be here today at the first session of the Vijayata program, which we have launched in collaboration with Philips. And this is a program reaching out to women, trying to explain to them what really is PCOS about and what we need to do in order to understand it so that you can make the best of your care and treatment. So let me make my presentation just now. Give me just half a minute and I will share my presentation with you. Can you see my presentation? Ruby, can you see my presentation?
Yes,
Hello?
ma'am. Now I can.
Yes, good.
Yes, ma'am. You
Yes,
clearly can
yes,
see.
ma'am, we can see it.
Okay, fine. So today we are going to discuss, something we wanted to make it very interesting for all of you. So we said let's have seasons. So like the Netflix series, you have season 1 of Vijayata, where we talk about PCOS and fertility. And in this season, we'll have 5 episodes of PCOS and fertility. And today we will be speaking mainly on what is PCOS, trying to describe to you what is PCOS. All these episodes are going to be sort of put on in a space where women who have not been able to listen to the first one, because the second one is going to be a continuation of the first one. So if you've missed it, you'll have to go on to the links and read it up quickly and be ready for the second one. So we have PCOS as what PCOS stands for is an acronym for polycystic ovarian syndrome. Now, 1 in every 5 Indian women suffers from PCOS, and it's not something very rare. It's something very, very common. As doctors, we see women in our clinics right from the age of 8 to 10 years going all the way down to 70, 75 years. So in short, it's a very, very common condition seen with us in our country, and it's there all over the world. And I think it's the obesity which has really exaggerated it and made it worse. So it can occur, as I said, with the first occurrence of menstruation, which is normally when we see it maximum. And definitely most of the women are diagnosed between the ages of 20 and 30 years, because that's when they go to the doctor to find out why she's not getting pregnant, or why her periods are irregular, or why she's having problems with her cosmetics, with her issues related to her cosmetic appearance, the obesity, etc., etc. Because earlier on, the girls go for their acne or their hirsutism, they do whatever little they can do at home, and then they go to parlors and get treated for the extra hair, extra acne, etc. And then they don't realize that they may be having, these are the symptoms, could be of PCOS. Now, PCOS in the past was also known as PCOD, or polycystic ovarian disease. It's not a disease because we do not know the reason why PCOS occurs. We know that it's a syndrome wherein there are multiple different things you can see, and it's not all the same things in every single patient. Some patients may have 2 or 3 types of symptoms, another patient may have another 2, 3 symptoms. So it varies, and therefore there is no proper sort of one fixed appearance of a PCOS. And therefore it's called PCOS, or the polycystic ovarian syndrome. Now here what we come to is a scientific way of diagnosing it. We take 3 factors. One is the factor where the girl has irregular periods. The second factor is when she's having trouble with her, facial cosmetic issues, like she's got hair loss on the scalp, she's got acne, she's got hirsutism, that is hair in places where men normally have hair. She may have loss of hair from the scalp, just like normally men may have. She's going on putting on weight, and she has no idea what's going on with her. And that's when she reaches the skin specialist, usually. The irregular period girl usually reaches the gynecologist or the pediatrician if she's younger. And the ones who come to us, they may have ovaries which look polycystic, just like they are looking here on the screen. Multiple eggs, or you see these are the follicles, small sacs containing multiple eggs in the ovaries, and this is not the normal appearance. And if one sees this, there is a proper definition to it where we say the size of the ovaries should be more than 10 ml, there should be so many eggs inside the ovaries, etc., etc. So this is the way we diagnose polycystic ovarian syndrome. And one point I want to take home here, that if you've gone to a sonographist and you've got a sonography done, wherein your ovaries are looking like this, but you have regular periods and you have no problems over here, then this is not considered as a PCOS. So confirming polycystic ovarian syndrome only on the basis of your ultrasound appearance of your ovaries is not correct. There should be at least 2 out of 3 things present. So you could have the combination of this 2, where there's no polycystic ovaries on ultrasound. It could be only these 2. It could be only these 2. Or it could be this, and it could be this. So in short, but in a young girl, if she's an adolescent, then she has to have all the 3 features before we say that it is polycystic ovarian syndrome or she's at risk of it, because many young girls who have just started menstruating between the ages of 12, 13, 14 may show ovaries like that, but they don't have PCOS. So mind you, only don't go by a diagnosis of an ultrasound scan. See whether there are other factors present. Of course, if you have a picture like this and if you have a young girl who's just got her periods, it's possible that she may be having irregular periods in the first year of her life. So again, don't jump to the conclusion, because a young girl, you have to have all these three things before you make a diagnosis. Whilst if it's a girl above 18, any two out of these three will give you a diagnosis of PCOS. Now, what really is it? This is irregular periods where there's no period for almost 6 weeks, 8 weeks. She will get less periods. She'll have less than 8 periods in a year. If there is a girl with acne, you'll get a lot of acne on the face, which keep coming even after teenage years. And then you have the hirsutism, where there's hair growing on the chin, hair growing on the face, hair growing in the upper lip. I've got girls today who are shaving twice a day. Twice a day is the amount of hair growth which is there, which is making them, sort of go on and on and on, just shaving or waxing or bleaching. They're so desperate. Now, this is the hair baldness which can occur. It occurs usually in the front of the scalp. This is how it usually starts, and then it extends into the center and goes on. So it's more of a frontal hair loss which occurs in women, and that's called female pattern baldness. Then you have obesity, which occurs mainly in the upper abdomen. This is the central obesity, as we call it. And why do we worry about this central obesity? Because there's more of fat collected inside. Actually, this picture, according to me, is not very clear, because in short, when you talk about fat over here, this waistline completely disappears. You get fat like this, like an apple. It goes all round. I'll show you in another picture, which is a correct picture. And here you have acanthosis nigricans, wherein you have darkening of the nape of the neck, of the skin. Now see the darkening on her face, see the dark hair growth on her face. So all this is supposed to be called acanthosis nigricans. Nigricans means blackish. Acanthosis means the skin. It sort of becomes velvety and it's thick and it's dark and it rises above the surface of your normal skin. So this is a kind of pattern you may see, and this is typical. Both these symptoms are typical of high insulin resistance, which I'll explain to you later. Acne, hirsutism, and baldness are more because of extra male hormones in the body, and irregular periods is because of an imbalance between the female and the male hormone in the body. So these are the various factors which cause these issues. Now, coming to regular periods and irregular periods, as I mentioned to you, most of the periods which are regular are usually more than 21 days. So it may be every 23 days, it may be every 25 days. Usually we get periods between 28 to 30 days. But if a woman is getting periods every 25 days regularly, then it's not an irregular period. If she's getting a period every 32 days, every month, then it's not an irregular period. But if some days she's getting a period less than 21 days, another day after 35 days, or she gets less than 8 cycles per year, or she's got no periods till the age of 15 years, then we say that probably she needs to see a doctor or her gynecologist to determine what is the problem, what is going on, because there are various reasons why a woman may have irregular periods. It may be that she's just reached puberty. For the first 1 or 2 years, her periods may be erratic, but later on they get regular. But if she's got to say a hormonal condition, suppose her thyroid is not working well, she may still have irregular periods. So you need to see the doctor to know what really is going on. It may be very easily correctable, and therefore the girl does not need to suffer. Many girls tell me, oh, my mom says even she had irregular periods, so it's fine. No, it's not fine. Those days maybe it was fine, but today it's not fine. You need to know what you have, and you can easily solve it because there's a lot of help available. Now, here is the high androgen levels. Look at the hirsutism. Look at the amount of hair growth. A young girl getting this is very, very embarrassed, and she's very desperate, and she needs some kind of quick treatment. She goes to the dermatologist. She goes to various parlors, gets it out. Again, it's back there in 8 days. So therefore, it's a very difficult situation, a lot of anxiety, a lot of mental stress, and a lot of becoming not social because they don't want to go out because they don't like the way they look, and they're comparing themselves to the peers or the girls they see or the beauty models they see on TV all the time. This is another pattern of obese we see with acanthosis nigricans. It looks very ugly, but once we start treatment, this entire thing completely disappears. Once you've corrected the insulin resistance, this will completely disappear. And 50% of PCOS women are insulin resistant. So you must remember that any hair which you get on the chin, which is going down into the neck, it may be in the upper lip, it may be around the nipples, it may be on the midline of the chest, midline of the abdomen. In short, it is a male pattern of hair distribution. Acne, as you see here, terrible looking acne, and this is something, again, girls are very embarrassed. I know during COVID, everyone was happy, everyone wore masks, nobody could see what's going on behind the mask. It helped. But yes, it cannot go on forever. COVID cannot go on forever. You cannot go around with a mask forever. And you need to understand why this problem is occurring in you persistently and how you can take care of it. This is the loss of scalp hair, as we see alopecia. It starts in the center, somewhere near the parting, and then gradually spreads, and then finally it goes like this. Now, this again can be corrected if you know what your problem is. See the doctor, confirm the problem, and then start with the therapy. Everything, all these issues, all these cosmetic issues cause a lot of anxiety, depression, stress, lack of sleep, eating disorders to the extent that some girls overeat just to keep themselves happy. And there are some who don't eat at all. They get undernourished and the periods don't come. The ones who become obese, their periods get erratic and then they bleed very heavily after 2-3 months of not getting their periods. While the girls who are anorexic or who don't want to eat at all, they lose so much weight that their periods stop, for a very long time, sometimes for a year, 2 years. All that requires therapy, all that requires seeing the doctor and getting the cause of your problem and then getting it corrected. So this polycystic ovaries may be present either in one ovary or it may be in both the ovaries. What you see, a typical pattern like this is, like it's almost like a pearl necklace sitting around. And this is what is called the pearl-like appearance of the follicles. And these are actually, these are small graphene follicles in which the eggs are there. Now, there is an egg in each of these that shows that you've got lots of eggs inside your ovaries, and each egg can help you have a baby if the egg meets the sperm. So it's something like this, that there are two functions of the ovary. One is to produce the hormone estrogen and the hormone progesterone, which helps with pregnancy. Estrogen helps you to grow into a woman, and the eggs inside help you to reproduce and have a baby. So now tell me how this PCOS affects a woman. First of all, in the young girl, there may be these issues of periods being irregular, cosmetic issues, body issues. The irregular periods in PCO patients is because of the imbalance of hormones which is there within her. And therefore, the ovary is not acting the way it should act, and therefore the periods go completely haywire. It may cause a lot of mental health issues because of the problems she's having, and of course, it's accompanied by insulin resistance in almost 50% of girls, in adolescents too. Whilst obesity is something which is spread all over, and therefore we tell young mothers, don't be happy when your baby is fat. Don't be happy because the baby looks cute when he's fat. But see that the baby gets the right nutrition, see that the baby is healthy, baby is active, and even if the baby is thin, it doesn't matter. As long as the child is not sick, as long as the child is not lying in bed all day or falling sick again and again, that child is doing fine. Then you come to the reproductive age group, wherein because of the irregular periods, because of the hormone imbalances, there is infertility creeping in, miscarriage happening, where you lose a pregnancy when you're already pregnant, usually in the first 3 months. And then as the pregnancy advances, there's a higher risk of developing diabetes and a higher risk of developing high blood pressure during pregnancy. Most of the women, they get back to normal after they deliver, but a few of them go on to proceed to diabetes for good and to high blood pressure for good. So therefore, those who become pregnant and those who have these problems during pregnancy should watch out for diabetes coming up or high blood pressure coming up post-delivery. Then, of course, as you get older, after the age of 50, higher chances of high blood pressure, high cholesterol, fatty liver, fat depositing in the liver, which affects the function of the liver. It can also cause heart problems because all these factors together are risk factors for a heart problem. And you'll be surprised to know that after the age of 50, women have an equal chance as men to have a heart attack. Whilst before the age of 50, it's the woman who's protected by the estrogen hormone and does not really have a risk of having a heart attack as much as men between 40 and 50. And therefore, estrogen, which is the female hormone, is very protective to us. And therefore, we tend not to have heart attacks before the age of menopause. Coming to obesity, as I told you, this obesity carries on. If it starts in childhood, it usually goes on unless you really take care. This obesity just goes on increasing. So in short, we know that there's PCOS in quite a large percentage of girls. We know that PCOS is existing today, right from adolescence to even beyond menopause. So what is the exact cause of this PCOS? Today, we still do not know. We have always thought genetics because we see it in running in families. But when they have done genetic tests, they have found hardly 5 to 10% have the same genetic mutation from their mothers or from their aunties or from the dad's side, etc. Now, coming to lifestyle, that seems to be a very, very important part because with lifestyle, you can control your weight, you can control your environment, but you cannot control your genes. So what genes you get from your mother, you got them. But lifestyle is something you can control. Lifestyle means eating right, not letting yourself put on weight, doing regular exercise, making sure that you get enough sleep. So this is lifestyle. Then there's the hormonal imbalance which occurs, and this hormonal imbalance gives rise to polycystic ovarian syndrome and all the things we have discussed till now. All this happens, and the biggest culprits of this are the male hormone which goes up, that is the androgens, and the insulin which goes up, which is insulin is a hormone which is produced from the pancreas, which is an organ in the abdomen, and it produces insulin which helps to maintain the blood sugar in your body. And when that insulin is not functioning well, then we call it insulin resistance. So in short, if you look at the PCOS women, 80% of them are obese and they have a waist circumference of more than 80 centimeters. Most of the obese women are insulin resistant and most of the 20% of them are lean or thin. Now, I think I've given you all quite a lot of information. Let me see how many of you can take this survey. So I'm going to ask for a survey form to come up and let's see how many of you can get this survey right. Can I have the survey, please? So please complete the survey. If your answer is yes to any 4 of the below questions, it is likely that you have PCOS. So the first question is, do you have delayed periods or do you have less than 8 periods in a year? Yes or no? Please strike the correct answer. Second question is, do you have thick hair growth on your upper lip, chin, chest, stomach or back? It will be either yes or no. Please tick yes or no. The third is, have you noticed thinning of hair on your scalp? Yes or no. Fourth, do you have acne or oily skin? Yes or no. Has your skin on the neck, underarms or groin become noticeably darker? Yes or no. Do you have dark skin tags on your body? Like there are blackish little moles sort of all over your body, usually on the face, the neck and the upper body. Yes or no? Are you finding it difficult to lose weight? Yes or no? Do you crave to eat anything sweet? You wanting to eat sweets all the time? Yes or no? Are you finding it difficult to get pregnant? Yes or no? Have you had a miscarriage in the first 3 months of pregnancy? Yes or no? So these are the various questions we have, and will help you to understand. If you've got more than 4 questions out of this, which are a yes, that means it's possible that you may have polycystic ovaries. And I think you need to learn a little bit more about it so that you can decide whether you need to see a doctor or not. So I think this is the survey we have taken, and we'll come up with the results very soon, and we'll let you know what our results are. So I'm going to continue with my broadcast and talk about what else is there to be seen. In short, I'm going to go back to my presentation and I will share with you where I left off. So 80% of them are obese and 20% of them are lean. Now, there may be many lean people amongst you who are sitting in the audience and may be having quite a few of these symptoms. So there's a possibility that you could have PCOS, and therefore it's important that you understand more of what we discuss. So we know that obesity is something which is a poor lifestyle situation. It's usually because we are too sedentary, we are all the time on computers, we are on our WhatsApp, we are on our phone, we are sitting in offices, munching away whilst working. And this is something which has taught us in COVID. There have been many, many young women who have put on weight, who have not been able to exercise because they didn't have the gym to go to. They were stuck at home. They couldn't even go for a walk. So it's been quite a difficult situation for people to maintain weight. You cannot have different food for different people in the home. So nutrition was a problem. The children want something else. The adults want something else. It became quite difficult for mothers to maintain that diet for everyone. Plus, there is so much of fast food available today, which is loaded with oil, loaded with wrong nutrition. And this is something which one must avoid and must take care. You go to the US and see the kind of amount of food you get in a plate. It's amazing. I always wonder. I think 4 people could eat out of 1 plate. They serve 1 person. And that is something, it's important. They must start serving less in a food. And then we say, don't sit at the table and eat. Pick up your food from the buffet table. Go sit somewhere else far away and eat so that you don't get up and go back to the table. That's a very, very good trick for yourself to avoid. All these colas, all these juices contain a lot of sugar. Again, that's totally a no-no for everyone. Eating junk foods which are pre-prepared, packaged, as you see over here, which I've talked earlier also, they're all high-calorie food. It's something like, you eat a bag of chips, you may be eating a great, almost 300-400 calories in this. And instead, if you eat a big plate of a salad, you have a soup and you have something steamed, you'll eat hardly 200 calories, hardly. So, and the filling of the stomach or the satiety will be still the same. So this is something we need to definitely avoid, and avoid drinking this sugary beverages which say 132 calories, but there's 40 grams of sugar in it. It's killing absolutely. So you got to get rid of it. Now, this is the obesity I was talking about. This is what we call central obesity, where it's like an apple. There's more fat on the waist than on the hips. And if you see this is a pear-shaped body where the waist is narrower and the hips are wider. This is a typical female body. This is a typical body where there's a lot of fat collecting within the abdomen. And, I can tell you as a surgeon, when I open an abdomen, it's a woman with insulin resistance, I see so much fat around the intestine. So as soon as I open the abdomen, the fat is popping out. So it's a difficult surgery for us, yes, but it's more difficult for the patient because that fat is also producing insulin. Now, what really happens with insulin resistance is, as the insulin gets secreted from the pancreas, this insulin is not functioning well. It's not able to bring on its function of reducing the blood sugar when a person eats. Normally, when we eat, the sugar levels rise in the blood, and the signal goes to the pancreas gland that starts secreting insulin. I need to get rid of this sugar. Now, if that insulin is not working well, the insulin is being secreted, but it's not able to function. It's inactive. It's like a very weak insulin. Then that sugar sort of starts going down, but more and more insulin needs to be released for that sugar to go back to its normal value. So in short, a stage comes when there's very high insulin in the body. And that's the insulin which makes you crave for sweets, which makes you put on weight around your waist. That's the insulin which is bad for your heart. It is more fat and less muscle. That's the insulin which collects a lot of fat in the abdomen, which creeps onto the liver and destroys the liver. So there is a lot of problems which occur with this very, very bad insulin resistance which you may have, which you can only get rid of by doing exercise and exercise and exercise and eating less and less of fat and calorie and sugar. So this is something as a principle of maintaining a good lifestyle. And today, actually, this waist circumference has become an important marker of obesity. We have always talked about something called BMI. When BMI is talked about, we say 18.5 is the global population is underweight. Okay, this is for the entire world population. But if you compare it to the Indian population, when your normal weight, your BMI should be 18 to 22.9. By BMI, I mean body, and they take the measurements of the height and the weight, and there's a formula to follow, and according to WHO, this should be it. Now, if you see the difference, overweight in a global population is when the BMI is between 25 to 29.9. But in the Asian population, which includes Indians, it is 23 to 24.9. Why is the difference there for the Indians? It's only because as Indians, at the same weight, say my weight may be 60 kilos, there's another American woman who's 60 kilos in weight. And if we would look at both our body compositions, you'll find there'll be more fat within me and less muscle as compared to the fat in the American girl or the muscle in that girl. She'll have more muscle, she'll have less fat. I will have more fat and less muscle. And therefore, today it's accepted that in the Asian population, which includes Indians, that if your BMI is between 23 to 25, then you're considered overweight. Whilst if you're more than 25, you're considered obese. So follow the Asian standards, not the global standards, because we are Indians and we need to follow the Indian standards. So this is something which obesity happens with insulin resistance. It's accompanied. The fat in the abdomen which is collecting is also secreting more insulin. The more insulin in your body, the more overweight you get. And the more overweight you get, more is the insulin resistance. So it's like a vicious cycle. Unless you get rid of that fat, the insulin levels are not going to go down. And you need to take some medication to help your insulin levels to work better. So those are called insulin sensitizers. When you have a lot of obesity, there's also the chances that you may have a lot of stress and sleep deprivation. And it could be either way. You're working too hard you're working too hard day and night, you're not sleeping enough, you're very stressed with your career, you may put on weight. So that is again, we don't know whether it's a chicken or egg situation, but it definitely does exist. There are other comorbidities which occur with PCOS. There's diabetes coming up as you grow older, high blood pressure, heart disease, as I've discussed before. And as you grow older, the menstrual periods can get affected. You can start getting period every 2 to 3 months, and the periods get very heavy. And if you don't take care, most of the women think, oh, I've reached menopause, that's why I'm getting this heavy period, which is wrong information. If you're getting your periods heavy at the age of 45, that by that time, actually, your period should be getting scantier. But if they start getting heavier, there's something going on inside here. It may be that you're developing the beginning of a cancer inside the uterus. So you need to see a doctor. Don't presume it is menopause coming in. You need to find out why you're bleeding heavy. I'm not saying you've got cancer. I'm just saying it is a risk factor when the lining of the uterus starts getting thicker. You may have sleep apnea, means you're sleeping and because you're overweight, you're obese, your nose gets blocked, your tongue falls back and then you snore. And then you're not breathing well and suddenly you wake up and you've realized that you're gasping for air. And this is called sleep apnea, which it gets worse and worse, it can cause very, very severe complications. So therefore, if there's sleep apnea, you need to see the sleep apnea doctor, and it can help you tremendously. Depression, anxiety, we have discussed, and eating and overeating becomes, binge eating becomes very, very common in such situations. Now, this is the overall background of what you see. Now, coming to how many women with PCOS have difficulty getting pregnant. So, in short, you see, 30% of them will have no problems, but about 70% of them, especially the women who have got irregular periods, are the ones who may have trouble getting pregnant because they've got a hormonal imbalance. They are not releasing an egg every month, and therefore they have a lower chance of getting pregnant. Not that it means you can't get pregnant. If you take help, if you get corrected at the right time, it's easy to get pregnant. So if you look at what are the causes of female infertility in a PCOS woman, most of the time in 40% of the patient, it is because of something, where the egg is not being released every month. Because if you get a period every month, one egg comes out. If you're getting period every 3 months, one egg comes out. If you're getting your period every 6 months, one egg comes out. And a woman can get pregnant only when the egg comes out. So in short, that is called ovulation. So if you're getting your period every month, you have a 12 times chance of getting pregnant in a year. And that egg remains alive for hardly 24 to 48 hours. If it meets a sperm during that period, only then you get pregnant. So therefore, an ovulatory disorder is something which is where the periods are coming late. There is a lower chance of getting pregnant because the eggs are not coming out, and it's very easy to treat. All you need to see your gynecologist and she'll help you out. Then, of course, there is something wrong with the uterus, could cause problems. There could be something with the tubes. It could be something with the hormones. It could be totally unexplained, where you don't know why you're not getting pregnant, where you've not been able to determine the cause. Now, when you have irregular periods, there's less of eggs, as I told you. If at all, it can also give rise to poor egg quality. Second is, if there is increased male hormone, there's a lower chance of the egg getting sort of fertilized by the sperm. So there are poorer embryos. It could be because there is a disturbance in the formation of healthy embryos. When the egg and sperm meet, the embryo which forms may not be healthy, and therefore it may not get implanted into the endometrium, or the endometrium or the lining of the uterus is not well formed because of the imbalance of hormones, and therefore there are lower amount of pregnancy. So there are various reasons. We need to correct all those reasons. So it could be either, as I told you, it could be a poor response to medication. If you give medication, they're still not ovulating. They may be having miscarriages. They may go into having poor egg and embryo quality. The lining of the uterus may not be responding well to accept the embryo. There may be complications with diabetes coming in, miscarriages. So there are so many issues which can occur, and that can only happen when you see the doctor. You'll know what's your problem. So in short, how do we improve our chances of getting pregnant? So what we say is that we need to discuss with the doctor as to how to correct the problem. Now, in women who have got PCOS at a younger age, we find that they have irregular periods. I think the best way to correct it is giving them some hormonal medication which helps their periods to come in time and not to bleed heavy. The second is, if a patient is wanting to become pregnant, then she must ask the doctor when she should she should see the doctor even before getting pregnant to know whether hormones are in balance. Is everything okay? Because if you haven't tested your sugars, if you haven't tested anything, you may get pregnant, but if your sugars are high, it will cause abnormalities in the baby, or it may end up with a miscarriage. So be careful, always see the doctor before planning a pregnancy. Aim for a healthy weight, and it's very well known scientifically that even if you have a 5 to 10% weight loss of your total body weight, it will help your pregnancy chances of becoming pregnant even 25% higher. So in short, it's something which it's really, really doable, and start doing it. And of course, if you decide to have your family earlier than 35 years, it's the best thing to do, because as you grow older, even though you may have more eggs in your ovary, still the age of 40 is like a roadblock. The chances of pregnancy go on reducing in spite of you having many eggs in your ovaries. It's the hormonal imbalance, or it's the aging of the eggs, whatever happens, but it definitely reduces your chances. Now, for a PCO patient, you need various doctors working together to help you the best. Your gynecologist may be well experienced and may be helping you with all these factors. She may be able to help you with everything. But at some point or the other, she'll need the help of the endocrinologist to help you in situations where she's not able to handle that problem. It's too complicated. too many hormonal imbalances. Your nutritionist is needed to sort of push you into eating right. You need a fitness expert to help you to put exercise, because I've seen a lot of lethargy, and therefore, to convince people that yes, you need to do it, you have to really push. And once the woman starts doing it and she has someone to support her, she sees the change, and then she goes on her own and does whatever she wishes to do. Coming to the dermatologist, with all the cosmetic issues which women have, I think the dermatologist plays an extremely important role to give her a very good body image, so she feels more confident, she feels better, and she has less mental stress. So this presentation is being brought to you by, by the PCOS Society of India, and we are at this point in time talking on the program of Vijayata, which is a outreach program of PCOS Society of India through this program which we are doing. We will also be going to various corporates. We'll be happy to have lectures for everyone in different centers and physically be present. So we have a huge number of people, physicians, who are happy to come and speak. And this is something which I wanted to say. And I think I wanted to thank Philips here and thank them for their support towards this wonderful program which has been created. And of course, I want Ruby to come back and give you some important information. And so I'm going to log off here and come back on the screen from this particular podium.
So much, ma'am. I think there were so many doubts in the audience. Questions, most of them had by you. Thank you for such a comprehensive, presentation. All things, what is PCOS and how does one identify whether I have PCOS or not? That assessment, I think, has really opened eyes of many of those. So I think let us also test the knowledge. We understood. So I think it will be better that I repeat the same questions which I asked in the session to understand how much you've understood. It's like a school exam, how much you've understood after this lecture. So I request my team to just show up those questions once again, and let's repeat to understand the knowledge that you've gained after ma'am's beautiful lecture.
I hope they do well, otherwise I will...
Again, all of you will get...
Yeah.
No, ma'am, I'm sure you're a very good teacher. You will get correct answers, and I will also share the right answers. Let's have all the questions from the very beginning once again, please. Again, all of you will get about 10 minutes to answer each question. And I begin with the first question, which is, do you think PCOS is associated with only obesity? Either you will answer or no. So no, correct. No is the correct answer, because now you learned but you may still have PCOS. That's the right answer for all of you who have answered. There's some coming in, and some of you are still answering. Okay. So some of you have said, about 20% of you, that PCOS is associated only with obesity. Now here I would like to share the correct answer is, it's not only that if you're obese, you may have PCOS. You may be looking thin, but still may have a PCOS depending upon the other symptoms that you have. So that's for those who haven't correctly answered. Okay. Can we have the next question, please? The diagnosis of this is made only by sonography. I repeat, the diagnosis of this is made only by sonography. Let's see how many of you correctly and how many of you have joined a little later during the session. And if some of you have missed this,
it will be nice if we can compare the two later.
Yes, we shall be. But currently, let's see how many people were attentive during the session. So we have all the answers.
That's it.
And 7% of them have said no. Yeah. Next, please.
Oh, stopped.
Can I have the third question, please?
I think they're stuck.
This is the beauty of the program. So, in all the episodes that we conduct, we will be having similar tests where we ask the same questions at the beginning of the session and at the end of the session. So then you will be evaluated by yourself also that yes, this is what we have learned. Because today there's a lot of misinformation which is available on the internet, and that gives you information which may or may not be correct. So it's better to learn from the experts. In fact, there are some questions which are coming in from the audience. So we can come back to the poll maybe after a while. But I think I would like to answer queries which are thrown up in the box. In fact, those who are still with us, if they want, they can ask a question on the Q&A box. We will answer them as possible. Now, I would like you to answer this person who has asked that I am a PCOS case. I had irregular cycle history. Can we continue the poll after this questions? My team will put the questions again after the questions. So I am a PCOS case. I had irregular cycle history. After 3 months, I got but now the bleeding is very prolonged. Every day I have to use couple of pads and it lasts 20 days. So is it normal for a PCOS girl to have such periods, big gap of few months?
I think it's a very common situation with either young girls or even older women where they get their periods every 2 to 3 months. The reason being there's an imbalance of the hormones. And then at the end of 2 or 3 months, when the period hasn't come, the lining inside the uterus has become thicker and thicker and thicker because it's the female hormone estrogen which makes the lining thicker. And if for 2-3 months there's no period, that lining becomes so thick that the hormone which is being released cannot support it, and then it comes out, and then it has to come out for a long time because there's too much collected inside. So in short, it's very common we see that, and it can happen more in women who have got more of obesity as compared to the lean women. We see more of period irregularities in girls or women who are overweight or who have a lot of obesity as compared to the lean PCOS. It can be easily managed. There is no problem. You can go to the doctor. The doctor will do a sonography. She'll see what's going on. She'll give you medication. The bleeding will stop. And she'll do the test, whatever is necessary to ascertain whether it's the PCOS causing a problem. Is it the thyroid causing a problem? Is there a cyst in the ovary? Is there any other reason? Was she pregnant and she had a miscarriage? There could be so many things going on. So unless you're investigated, you do not know what really has caused that heavy bleeding. But yes, irregular periods followed by heavy bleeding is quite often seen.
Okay. And it may happen in the next period also.
Yes. It can happen over.
That's a very interesting question.
Yeah.
Okay. This is typical of PCOS. And there's a very interesting question, a very big concern of a mother. She writes, my daughter is overweight. Her age is 9 now. And I am also overweight. She got her period once, but it's been more than a year now. She has not got her periods. Do I visit a gynecologist? Is she already PCOS? Because I had PCOS. What do I do?
If the daughter has got her period for the first time at the age of 14, was it the first time she got her period at 14? What was the question?
Ma'am, she's 9.
She's 9 years old. Okay. So
Ma'am, she's 9 years old. She's 9 years old.
Yeah. So normally in India, most of the girls reach puberty or they get their first period at the age of 13, 12 or 13. Sometimes even 11. The more overweight a girl is, the earlier she gets her period because the fat in her body is also producing estrogen hormone. So I think the little girl who's 9 probably is reaching puberty early. I think the mother should make sure to find whether there's any evidence of male hormone in the girl child. Look at the possibility of her, hair, sort of the pubic hair coming up, or the breast developing, or the underarm hair coming up. If those hair are coming up, or if there are too many at the age of 9, which should not be, then she must see the pediatrician, get the child checked out. And then if the child is obese, that could be one reason why everything is happening too fast. It's possible that the girl may have PCOS, but very difficult to diagnose at this stage But yes, one thing I can say, if the puberty occurs early, it will stunt the height of the girl. So, she'll get to be a tall child now, and then she may, because she's producing estrogen very early in life, her bones will stop growing later when, if she's suppose in the second or third or fourth standard, and she's taller compared to everyone in her class. But by the time she reaches ninth standard, she'll be the shortest girl in the class because her growth spurt would have been affected. So I think it's important that the girl should see a doctor. I mean, the mother should take her girl to the doctor, at least get her investigated. You may do nothing, but at least get her investigated. You're muted.
There is another question. Ma'am, there is another question. She has not mentioned the age of her daughter. First, her question was, what is PCOS? I hope we have answered your question. We have learned what is PCOS. The second question is, my daughter gets severe pain when her periods come. She takes Medfal. This is what she has mentioned. So just for other knowledge and her knowledge, does she see a doctor, I mean, irrespective of her age, or is it okay to take a painkiller during the periods because of PCOS?
See, it's with PCOS, there is no reason why a girl should get pain during periods. The pain during periods happens in many young girls, and it's quite normally seen for half a day, one day, that there is a little discomfort, there are some cramps, and they usually go away and do not affect the normal lifestyle of a girl. But if the pain is so severe that the girl cannot go to school or she cannot participate in any of her normal activities, then yes, she needs to see the doctor, because there could be some other reason why she's getting the pain. So I think any young girl who's menstruating, most of the times we find that it's because of ovulation that she gets pain. A girl who releases an egg every month, we have found that those are the girls who have discomfort when they get their periods. And then, it's there for a very short time. It goes away with one tablet she may take. There's no harm in taking the tablet. There are many mothers where they find the girls are getting severe pain and they still don't give the tablets because they say, oh, you'll get used to it. Or it's not good to take tablets or something like this, which is not right. If a girl is in pain, she needs to get the treatment, what she needs. But if the pain is lasting more than a day or it's affecting her day-to-day activities, like she can't go to school, she's vomiting, she's fainting, she has to see the doctor to find out the cause of the pain.
Okay. All right. Only a painkiller is not sufficient.
No, one tablet. See, one tablet taking is not a problem. But over the years, if you find that, okay, now one tablet is not enough, I have to take 2, then I have to take 3, then I have to take 6 in that cycle, or I have to take 10 in the cycle. I need to take 2 strips. If that pain is going on increasing, there is some problem. So the patient has to see the doctor.
Okay, I hope we've answered your question, Vidhi. Thank you for the question. Now we will take a question and we'll come back to the poll now. Now this question is actually about the medicines best for subfertile women and adolescents. I think we will take this question in the forthcoming episodes where we talk about the treatment. So whoever has asked this question, we request you to come back and in the future episodes to get the answer to this question from the expert. But last question is, ma'am, this is very relevant to today's session, that I am diabetic and I had PCOS before conceived and I've got 2 kids now, one boy and a girl. You must have gone through some treatment, she says, to get a daughter and a son now. Now her worry is, I had diabetes. So now, will both son and daughter have diabetes, or only my daughter will have diabetes and PCOS? What does the future look like?
You brought in a very, very interesting subject, which is something which is now very, very recent, wherein we say that though 5 to 10% of PCOS is transmitted genetically through her genes from a mother to a daughter, but more than that, it is the environment inside the womb, inside which the baby is growing for 9 months. And that is what we call in utero transmission. In utero means it is within the womb. And in mothers who are diabetic with uncontrolled sugars when they are pregnant, women who have got high insulin resistance, which is not controlled during pregnancy, or who are very obese and they get pregnant, these are the women who have got a very, very imbalanced inside of the uterus, where the baby is exposed to those imbalanced, environment, and that causes mutations in her genes. That's called epigenetics, and that causes the problems in the child. Now, these children have been followed up when they are born, and it's found that even the boys suffer, even the girls suffer. So it's not only the girls, even the boys suffer. The girls, even at birth, show a problem, even the boys show a problem. These children have been followed up for the next 40 years, and they have found that these are the girls and boys who become diabetic, who have high cholesterol, who have hypertension, which come up. And therefore, in boys, what we are now, the concept is that those boys who are getting bald very early in life, before the age of 35, if they are losing their hair, the reason concept is that these are the boys who may have been born to PCOS mothers and have got their genes sort of mutated because of the presence of high sugar and high male hormones in the body of the mother. So in short, these are the newer concepts, but yes, in this case, if the woman has diabetes, she's conceived, she's got a baby, she's got 2 children, but if her sugars were well controlled even before she got pregnant, then I don't think it would have passed on to the children. But if the birth weight of those babies, we can get a judgment whether the sugar was well controlled or not. If you see, the average age of babies in Indian women is about 33.2 kilos, 3.3 max. But if the baby is born 3.7, 3.8, 4 kilos, then we know that this mother was not controlled with her sugar during pregnancy. And therefore, the babies were large. And this is a sort of a signal to say that these children could have problems, and therefore these children should be then monitored, prevent them from getting obese, give them good eating habits, encourage them to exercise, and this is what we need to do. So I think I hope it's answered the question of this lady.
Yes, ma'am. I think with more sessions coming up, more questions. News here is she was a PCOS woman. She had diabetes, but she had 2 kids, a boy and a girl.
Yes, it's 100% possible.
Okay, I think we'll go back to the have to end the session due to the paucity of time. Thank you so much, ma'am, for the audience for bringing up such interesting questions.
Thank you so much.
And once again, I thank you time and inputs. Thank you so much, ma'am.
Thank you.
Before we end, we'll go back to the poll. So the question is, are irregular periods a sign of PCOS? Question which I asked. The question that all of you have to answer is darkening arms, groin, and nape of the neck a clinical feature of PCOS? Ma'am showing the slide, so you can get a hint from that particular slide where she showed the symptoms of PCOS. You have 5 seconds more to answer this question. Perfect. Bingo. All of you have answered the question. It is one of the signs of PCOS. All of you have learned very well. Ma'am, the slide was very, very informative and educational. Next question. Can women PCOS in their younger days, which disappears as they grow older? 20 seconds. Can PCOS women have PCOD in the disappears in the later years of their life? Last 2 seconds remaining. So we've got mixed answers. So yes is coming from 6% and no is coming from 33%. So the actual answer is that yes, PCOS remains. The symptoms may vary, but it just doesn't disappear once you have PCOS. Okay, I think that we will also explain you in the sessions coming ahead. Next question, please. The first line of treatment of PCOS women is lifestyle management, which includes diet, exercise, stress management, good sleep, overall a better life. So is that the first line of treatment?
Yes.
10 seconds remaining.
They all know the answer.
I hope it's not a guesswork.
No.
Well, Now, last 2 seconds. So for those who have answered no, let me tell you that in 2018, okay, published the evidence-based guidelines of PCOS internationally, way back in 2018. The first line, I repeat the word first, the first line of treatment of PCOS is lifestyle. There are other treatment modalities also, like drugs and other things. But the first line who are getting treated for PCOS is improving your lifestyle. So those who have answered 86% have answered in place. Well done. Next question, please. Is a low carb and a high protein diet ideal for PCOS patients? I repeat terms, low carbohydrate diet and high protein diet. Is this the right diet for anybody with PCOS? We have 10 more seconds to be answered.
The right answer. You don't need to wait. I think 10
Yes, ma'am,
seconds.
you were right. They have got it right.
Yeah.
They were very quick in this. So we have the next question on the screen, please. Can a woman with this get pregnant? I think ma'am has reiterated this couple of times during the session. But can a woman with PCOS get pregnant?
100%.
Yes, ma'am. I think they, undoubtedly they said yes. So there is no more myth. Earlier there was a myth that if you have PCOS, it's impossible or difficult. But today with the available treatments, yes, a PCOS woman can get, and I think 100% correct answer on the screen. Last two questions on the screen, please. The ninth question is, does losing weight help in getting if you have PCOS? And this is especially for the women who are overweight or obese side. So we have few more seconds. This is changing. Okay. Okay. So those who have answered yes, correct. Because clinically and there is scientific evidence that even if you lose 5%, it helps in better outcome. So those who have said no, 13%, they work, the patients have to work on their lifestyle management to reduce some amount of body. And that also helps in losing the body fat percentage. So yes, weight loss is very important. And the last question coming up on the screen, the fastest finger, I think. Okay. Is a woman with PCOS at a of getting diabetes and high blood pressure? I think ma'am has also mentioned this in her presentation. Last 10 seconds remaining. I remember the answer of before we began the session. And their answer was almost nearly 50. It's getting better. Yes. Yes, it is better than the answer which I got in the beginning of the session, where majority of the thought is, but now they have learned after your presentation, ma'am. In fact, you're a very good teacher. You've taught them in 20 that yes, a woman with PCOS is definitely having a higher chance of having diabetes pressure uh, in all the PCOS women. So thank you so much for answering all the 10 questions and for being so attentive and listening to ma'am and self-evaluating how many answers you've got correct. Wonderful. Brings me to the end of today's session. So it's an honor for me to present a formal vote. Firstly, a big thanks to all the attendees who are in today's session because without you, this program wouldn't have been possible. Of course, it's the mastermind, the brainchild of Dr. Durusha ma'am itself. With great encouragement, we teamed up with Philips, and today we have presented this. Has done the honors. As you know, she's the president of the society. Myself, Ruby. We are the co-chair and the chair of the Special Interest Group on Public Awareness. So thanks, Shobna, being a part of this group. And the entire team of Vijeta, where we mostly and the technical team behind who has put this together and this interesting polls that show. Thank you so much, the entire team of Vijeta. And if you have still more query, you can with Miss Vinita Mulchandani, who is the manager of this program, which is an educational purpose, manager.vijeta.pcos@gmail.com. We'll be happy to answer those queries. If you have missed asking the questions, please feel free to write to us. We will be able to help you with the answers. And this is not the end of the show. This is just the beginning. This is the end of the season 1. We will come up with the next episode in the next week. Every 3 to 4 p.m. every Saturday, we'll be presenting different episodes. Like today we have 6. Very soon we will talk about the diagnosis and investigation. So the next episode, the 18th of the March, which is today, we will be presenting to you about diagnosis and investigations. If you have PCOS or if you have a doubt whether if you have PCOS or not, what are the tests to be done, how to confirm. And for that, we will have our eminent speaker, Dr. Shobna, who is of this special group. Ma'am will be taking us through all the tests to be done for confirming if you have PCOS. I'll be very happy to have all of you back again because this is and see episode after episode you learn more and more about PCOS. Format so that you learn better to make sure that, and you can also bring in your friends, colleagues, your sister, your mother, or any other person who is willing to know the PCOS. We'll be very happy to have you in big numbers henceforth. This brings session today. Once again, I thank everyone who spared their time. And I look for all of you. Thank you so much. And be a Vijeta. Win over PCOS. That's our goal. And let's come together to be a Vijeta. Thank you so much. Looking forward to you. Please visit our website, www.pcosindia.org, where you can connect. Thank you so much. Have a lovely evening. Thank you, Duru ma'am. Thank you, the entire team who's with us today so much.
Thank you. Thank you very much.